So when patients are diagnosed with early Alzheimer's disease, I think often a pressing concern is what the future holds. And unfortunately, that's very difficult to predict. So we get a positive biomarker back, and there are, some indicators in those results or in other changes in the brain. If there's, evidence of neurodegeneration, that the disease may be more advanced or less advanced. But I think more research needs to be done in that area to provide patients and their caregivers with more prognostic information. Many patients who are amyloid positive may not go on to develop Alzheimer's disease in their lifetime. If you have Alzheimer pathology in the brain, but the progression is very slow, and you live out your life and don't develop clinical symptoms and pass, you may have had Alzheimer pathology, but you didn't have the clinical Alzheimer's disease in life. And so if we can make changes in people's lifestyle, in their vascular risks, for example, that may make a difference in the long run. Patients do want to know what their prognosis is, what to expect. Families are always asking, what's the next thing that'll happen? And, we just can't predict that well. But I think development of other biomarkers, perhaps synaptic biomarkers or neurodegeneration biomarkers or other vascular biomarkers, will allow us a better understanding of what the prognosis is for that patient and allow them to make some plans along the way. Some people are unfortunately going to progress quickly and some people very slowly. Early diagnosis, I think, gives patients the options to make informed decisions. Unfortunately, the disease can affect sometimes their motivation or ability to make decisions. So even though you make an early diagnosis, depending upon how the disease affects the person, sometimes it's just short-term memory that's, really affected, and they are able to make plans and decisions and carry about their lives. Sometimes it might be a language difficulty or a more perceptual or spatial disturbance. But of course, sometimes the disease affects our planning abilities. And even though patients are afforded the opportunity, they may not be able to take that opportunity to make those plans. I think it's important to have trusted resources for patients to be able to read up on the disease. And we would like them to want to know about power of attorney and financial planning. I think people want to know what treatment options are available and what sort of difference they make in their lives. Family members, want to know how to care for the patient and plan for the future. There are disparities in the quality of, medical care they may be able to receive. Perhaps the clinic doesn't have a multidisciplinary team that can care for the patient, or they're already overburdened because there are, so many patients waiting to be seen. We're not necessarily talking about giving more care to other, some people, but being able to just get, basic good care that involves symptomatic treatment, that involves medications that slow the progression of the disease. Sometimes we're presented with patients who have changes in their mood, for example, or changes in their sleep, and they have memory problems. And so we say, okay, what's most important for you for a treatment today? What understanding do you want from the disease today? If you knew the specific diagnosis, would that help you? Sometimes patients say no, but families say yes. And, so then we talk about that a bit. We encourage and support patients in making choices for their own health, certainly if they're able to do that, and involve the caregiver so that we develop a plan that people are, personally supportive of and agree to. And we can change that plan over time as patients' needs and wishes change. The advocacy groups are voice for patients and making sure that patients are part of teams making up new recommendations for how diseases can be treated. One person can't speak for everyone, but there's at least a voice in the room to understand the lived experience of the person. The advocacy groups, I know, support research. They provide very valuable education, research, support groups. They obviously advocate for the needs of that patient population, but people are really hungry for information, and so they get a lot of it through these advocacy groups, and the promotion of the patient's voice and the caregiver's voice is very important. So I think encouraging research is important, and I think patients are really reluctant to ask their physicians for information. Call up, ask questions. You can come prepared to a visit with questions, get the answers you need so that, you feel you can make some plans for the future, and that your wishes are being addressed. Even though I may have had a grandmother with, Alzheimer's and vascular dementia, and we cared for her, I haven't lived that experience yet. Even though I've taken care of patients for 30 years, I haven't lived their own experience yet. And so I would encourage patients who are able to speak up to be an advocate for themselves and for others, because sharing their lived experience is so important for us to understand how best to address their hopes and fears with a disease.